All right, and moving on to the next story that we've got for you this morning. We'll speak about a man. He is one of the most celebrated, most inspiring, most fit entrepreneurs we have in India. And yesterday, he revealed that he suffered a mild heart stroke. This at the age of just 45. You know who I'm talking about, right? It's Nikhil, beg your pardon, his brother, Nitin Kamath, who runs marathons. You can see those pictures over there, maintains an extremely healthy lifestyle. We see him muscled, we see him lean, doing his regular workout sessions with his company folks, with his friends, with his family. Every weekend he's literally out there, and during the week as well, rock climbing, etc. But yesterday he tweeted this. Let's bring that picture out. He tweeted that around 6 weeks ago, he had a mild stroke out of the blue. His dad has recently passed away. He had poor sleep, he had exhaustion, he had dehydration and overworking out as well. These, he says, is one of the many possible reasons why he could have had that mild stroke. He says he's gone from having a big droop on his face and not being able to read or write to having a slight droop now, but being able to read and write. From being absent-minded to being more present-minded. So for about 3 to 6 months, he says there will be that's the full recovery period, best case scenario over there. And he says he's also wondering why a person who's so fit and takes care of himself could be affected in this manner. And that's really something that has struck a chord with so many of us. A person so fit getting a stroke. The doctors, he says, have said that he needs to shift his gears in life and slow down a little bit. And in his own words, he says he's slightly broken, but he tweeted those pictures. I'll request my producers. Yeah, those are the pictures that he tweeted, saying that he is still getting some steps on the treadmill. Inspiring guy. You meet him, you hear about his life. There's so much to learn. But this is seriously setting alarm bells, and I want to understand what is contributing to these strokes in fit young adults, aware people. So joining us for this is Dr. Kunal Bahrani. He's a neurologist at Fortis, Faridabad. Good morning, Doc.
Good morning.
It's a morning where we're spending a lot of educational things we're learning with a lot of doctors. Yes. But this is shocking.
Yeah.
Firstly, tell me, he's so aware, he knows different factors that could have contributed to his stroke. But can you, in Asan Bhasha, explain to our viewers what can cause a stroke?
So to start with, starting with this picture only, so there are more astonishing figures beyond this number. So if you ask in our country only, in our India, every minute at least 3 people suffers from a stroke, every minute. In a day, 3,000 to 4,000 people suffer from a stroke. And if I
and
ask
these are
you,
young people?
Yeah. So among these 3,000, 4,000 numbers, there are 15 to 20% who are young.
50 to 20%.
15 to 20.
15 to 20%
are young strokes. And if I ask you how many people die out of stroke, you will be surprised to know every hour, har ek ghante mein, there are 15 people who die out of this stroke in our country. So these figures are definitely too astonishing. And why I'm saying so? Because recently there was a survey among the metro cities. 48 to 50% of the people, they were not aware what are the warning symptoms of stroke or what is a stroke. They were not aware of the stroke. So many people among us, they feel that stroke is a heart attack, like the layman. Yeah. But it's not a heart attack, it's a brain attack. So it's a problem, it's a neurological problem where the arteries of the brain, they get blocked and they stop supplying the oxygen to the brain cells. That's why patients suffer from a stroke. So definitely there are warning symptoms of a stroke. Then one has to understand and immediately rush to a hospital.
Right. In fact, we've got a graphic also for our viewers. It's pretty explanatory on what are the first signs. I'll get to what causes a stroke in a bit. But with a stroke, what we know, that's the one. And I want everybody watching us right now, please take screenshots, please take pictures, circulate this video, and make yourself more aware of how you can treat it, because strokes you can prevent death if you respond in time. So what should one do? Firstly, tell us what are the signs? How should I tell if somebody is having a
So
stroke?
we can see out of this picture, it is very easy to understand, and it's a mnemonic, very easy to get its insight. Like it's a B fast. So B is like balance disorder. Suddenly, if a patient feels unbalancing, if he is not able to walk, I stands for eye problem. Suddenly, if patient is not able to see the object, if he's seeing some blurring vision, if he's not able to see clearly, F means face. So like this case, if suddenly feels some problem in the face, drooling of face, or if there is a not able to lift his eyes,
Or no response?
no response. A stands for arm. If not able to lift his arm or her arm, or not able to his feet, is able to dragging the feet. As for speech, if he is able to not able to speak clearly, if not able to express his words, and T stands for time. At that very moment, one should know the time. One should exactly note down the time, and one should immediately rush to a stroke-ready hospital. So why I'm saying to a stroke-ready hospital, that is very important, because a stroke-ready hospital is where there is availability of CT scan or MRI, where there is availability of 24/7 of a neurologist, so that one can easily find out the symptoms of stroke and one can go through the treatment of this stroke.
Okay, so this is interesting. Be fast. If you follow this, you will know these are some telltale signs of that a person is suffering from a stroke. I've identified now that somebody is suffering from stroke. What should I do next?
So next, immediately note down the time and rush to a stroke-ready hospital. That's what I'm saying. So many times we feel even one is calling to his practitioner, one is calling to his doctor to come in to see him. So that is the time where he's missing those time.
So don't call your doctor, just rush to a hospital.
Rush to a hospital, a stroke-ready hospital. Why I'm saying stroke-ready hospital?
They have to have MRIs.
Yeah, one has to have that stroke-ready hospital should have a MRI or CT scan, and one should have a availability of a neurologist. Why I'm saying so? Because initial 4.5 hours is a golden period of stroke. So initial 4.5 hours, why it is a golden period? That is the time where we can give a medicine that is called a clot dissolving medicine, where it can prevent the disastrous nature of that stroke. That can only be given within a 4.5 hours time. So that is the reason we have to rush to a nearby stroke-ready hospital.
Right.
So beyond that medicine, there are other modalities also where we can do, like mechanical thrombectomy nowadays are common in specialized centers. But till date, most important is to rush to a stroke-ready hospital within 4.5 hours.
Right.
That doesn't mean one has to wait for half an hour, 1 hour to his home, then he can call the doctor, then he should. Because time is brain, that means every second, millions of neurons in the brains are getting lost because of this stroke. So that is the reason immediately if he suffers, if one is noticed this warning signs of stroke, immediately rush to a stroke-ready hospital.
So that's good to know, Doc. So I now know how to identify a stroke. I know what to do if I have someone around me who has got a stroke. Now can we get to how to avoid all of this?
So
how do we ensure that we don't get a stroke? Because again, the question here is as if somebody as fit as him, somebody as aware of as him, if somebody who is so clear with what they're putting into their body, is lean, is mean, and is eating clean. Like, you know, and it brings me back to a discussion we had a couple of weeks ago on this program when the Millennium Cyclist had lost his life. He used to cycle 100 kilometers every day. And we talked about how too much exercise or how much exercise is actually too much exercise. And there the doctor had said a beautiful thing, that just because you're lean and muscled doesn't mean you're fit. So what contributes to fitness?
So nowadays we have frequently, like if I start with, there are 3 pillars of health. So one is definitely eating habits, that is the nutrition. Second is definitely physical activity. Third is sleep. These are the 3 pillars of health, one we should definitely be focused on. Fourth definitely is the mental health also. So nowadays we mainly see the physical health. One is fitness freak, one is doing the exercises, one is very strong personality. But at the same time, one is not focusing on the mental health. So these 2 parameters, like mental health and the sleep, one has to be very cautious. Why I'm saying so? Because nowadays sleep is one of the biggest known risk factors for all these problems, like stroke, heart attacks. Because there are people who are sleep deprived. They are suffering from insomnia. They are suffering from sleep disorders like sleep apnea. They snore a lot during the night times.
So what should they do?
So usually they should consult to a doctor if there is some sleep problems because of these shifts, day and night shifts, because this insomnia problem, not able to sleep properly.
We have that in our newsroom. So.
Yes. So there are these risk factors, these are hidden risk factors which we are not aware of. because we always aware of traditional risk factors like diabetes, hypertension. These all we know for ages now. But these are the newest risk factors we should take care of. Sleep is one of the strong risk factors. That is the reason if someone is suffering from sleep problem, one has to come out. One has to meet a doctor that he is suffering or she is suffering from sleep problems.
Because a lot of people, especially in their old age, say that ab to umar ho gayi hai, ab
Yes.
neend nahi aati.
Neend nahi aati.
But they should be concerned.
Definitely. Not only the elderlies, even we have seen the youngers because of these shift work, they have lost their sleep cycle. So it is not the quantity of sleep which is very important, it is the quality of sleep. Because if you see the sleep, there is a non-REM sleep which is there for 6-7 hours during the night time.
Yeah.
During this non-REM sleep, that is very, very important. And many times the youngsters are missing that non-REM sleep because they work during the night time.
REM is rapid eye movement.
Yes, so it's basically two types, non-REM, REM. So non-REM sleep is very important because this is the sleep where the autonomic nervous system, where it's our inner system that controls the heart, that controls the autonomic system, that controls the heart rate. So these things are very important because ultimately if we keep a toll on them, ultimately these will happen. Strokes, heart attacks.
You know what, Doc, we started this conversation talking about strokes. We have sort of gravitated towards sleep. I think there's a separate episode required only for sleep management and what we should be doing. But we'll definitely return to that conversation. But nice of you. I think this Be Fast way is a good way for people to identify. And the takeaway for all of you watching right now should be how to identify what to do next. And then, of course, preventive measures. Talking about preventive measures, it is about doing exercise the right way.